Hi everyone, here's your data update for Phase 2. As of May 3rd, 4 in 10, or 45% of Chicagoans, have received a first dose of vaccine. 5 in 10 Chicagoans 18 plus, and 2 in 3 Chicagoans 65 plus have received a first dose of vaccine as well. On the left, you can see Chicago's 7-day rolling average of first doses in blue, completed series in green, and total doses in black. Our current 7-day rolling average is 17,847 doses per day, compared to 31,431 at the peak in mid-April. Across the country, the trend is similar, as you can see on the right. Average doses per day are down nationally from mid-April, from 4 million a day to 2 million a day. For a second week, we've seen a decrease of vaccination across all settings, with the largest declines in pharmacy and public health vaccine administration. An additional 130,000 Chicagoans were considered to have an incomplete or late vaccination series this past week. This is when 42 days have passed since the first dose. Outpatient and urgent care settings still have the highest percentage of incomplete series. So let's make sure your data is going through and that you're recalling people who have missed their second appointments. With data through May 3rd, the percent of first doses administered by race ethnicity looked more equitable over the past week, with 66% of first doses going to Black and Latinx Chicagoans. This is great, but we are still struggling to make vaccine coverage equal across all community areas in the city. Here's a look at the percentage of each community area with at least one dose on the left and a completed series on the right. Unfortunately, we're starting to see cases show up in areas of the city with lower vaccination coverage. This is somewhat promising that the vaccine could be starting to work. But not only that, in areas with lower vaccine coverage, there were more hospitalizations from when we started vaccinating in January to now. This aligns with data published May 7th in the MMWR on the effectiveness of Pfizer and Moderna vaccines against COVID-19 among hospitalized adults 65 plus. The data was from January to March and shows a 94% decrease in the risk of hospitalization 14 or more days after the second dose. This is information your patients need to make informed decisions. So even though we're doing better than or similar to most other large cities in terms of our overall coverage, and we're doing better than other large cities in terms of equitable distribution, Chicago is still behind the rest of the country with our 65 plus coverage, and they are our most vulnerable population. Now we have data that all 3 vaccines under emergency use authorization reduce severe COVID-19 in adults 65 plus. So please share this with your patients because it might turn the tide on their decision making. In other good news, 22% of 16 to 17-year-olds, the dark blue line here, have already been vaccinated with at least one dose, and 5% have a completed series. 16 to 17-year-olds are the only age group actually to have an increase in their 7-day rolling average between April and May. Remember that Pfizer is on track to receive emergency use authorization soon for 12 to 15-year-olds, and the ACIP is meeting next Wednesday to approve it as well. So check out our health alert from May 5th for tips on how to prepare. And please think about getting other providers enrolled in your community so that we can start vaccinating teens as soon as that ACIP meeting happens. Thank you for everything you do to get Chicago's families vaccinated. See you next week.